I'm your host, Brad Christian, Managing Director here at Market Force Information, and I'm joined with a special guest, Jim Bartlett, Senior Vice President of Bureau Veritas. Jim, why don't you say hello?
Hello there, and thanks, Brad. It's a pleasure to participate today. I'm Jim Bartlett with BV's North American Building and Infrastructure Division. I specialize in building assessment and project management. We do a lot of retail here in North America. For those of you who are not familiar with BV, we were formed nearly 200 years ago in France, as literally as the Bureau of Truth, to help businesses, consumers, and governments establish trust with independent inspection, testing, and certification. Today, we're a global brand with over 70,000 employees in 140 countries. And one of our current missions is to help our clients restart their businesses safely.
Perfect. Thanks, Jim. So this will be our third webinar in our Consumer Sentiment Measure series. We embarked on this set of studies right as the COVID-19 pandemic set in, and our goal was to track consumer perception over time as shelter-in-place conditions set in and how those perceptions ultimately impacted consumer behavior. We have now conducted 3 separate waves of the study. The first wave was conducted April 6th through 8th. The second was May 6th and 8th. And then this current wave that we're going to take you through is was conducted June 24th through 26th. So what we learned in April was that consumers were concerned. 80% were in complete agreement that the shelter-in-place and social distancing requirements were completely appropriate. 50% thought it would change the world as we know it, and 1 in 3 expected their actual behaviors to change as well. In fact, we learned that 20% of consumers actively tried a new restaurant brand during the pandemic. Now, the drivers for this change were interesting. Some were fairly obvious, such as their usual option was not open, or maybe another restaurant had access to a different service channel like drive-through or curbside. Wasn't as obvious was the notion that certain restaurants just being less busy. The fact that there were fewer people at a restaurant apparently was a traffic driver, which was an interesting observation. And then consumers seeing active cleaning taking place as they patronized a restaurant, either through the drive-through or a walk-up, etc. So that was also a little bit of an unexpected influence to consumer behavior. We saw that 40% of the consumers observed enhanced cleaning or sanitization, and 62% saw signage which increased their confidence. And this was actually one of our other first insights, that simply putting content on the windows or walls, or even in some cases on the floors, confidence and built trust. However, only 32% were completely satisfied with what they saw employees doing in terms of being confident about that. And today, building confidence in both your employees and guests is the key to becoming safely and confident. But there's just so much to consider. You can see here all the different things that need to be contemplated and protected against.
Yeah, Brad, that's right. There's clearly a lot going on in an open store environment. You need to make sure that you've got the right things on your checklist, not only to meet the current best practices and the CDC guidance, but also the ever-changing regulatory requirements. One of the things we're doing in our audit program, we look at your policies, but then we have them independently reviewed by the Cleveland Clinic, with a partnership that we have to help keep you up to date, not just on the facts, but things as they change. And they are changing very rapidly.
Got it. Thanks, Jim. That's absolutely true. So our third wave engaged over 5,000 consumers here in the United States, as I mentioned, between June 24th and 26th. The majority were female, and 66% earned over $50,000 per year. And with the exception of millennials, there was a very even distribution of respondents by age. So what did we learn? Well, the first thing we saw in the third wave is people are still concerned. In fact, we got feedback that people were anxious about a second outbreak. We also found out that they absolutely want to get back into restaurants just as soon as they can, and but not without a little bit of a caveat. They want to see safety standards in place. So it's going to be really important for them to see that. Almost 7 out of 10 consumers indicated that they were either concerned or very concerned about a second outbreak of the virus. In fact, this feedback actually came before the heightened case counts that we saw crop up this past weekend in some of the various states here in the United States. We want to understand where people want to go when they are free and clear to do whatever it is they want to do. And the number one response was to dine at a restaurant. 81% of our respondents told us this. 71% wanted to get back into a retail store, and a little over half said they wanted to go see a movie. So restaurants have a unique opportunity to capture traffic as consumers have the confidence to ease back into the marketplace. But that comes with an expectation. Clearly, compliance with COVID-19 considerations matter. Both front of house, things guests can see like gloves, masks, plexiglass, and social distancing, all will be important, as 68% of our respondents told us that really mattered to them. However, even more important were the things that we cannot see. What happens in the kitchen and other areas that are not accessible to customers? An even greater number of respondents, 78%, suggested that this was also a really important consideration. So this actually got us thinking, how could a business ensure consumer trust in things they actually can't see in the back of the house? And so we posed the question, what if a restaurant could secure some form of public certification? And indeed, 57% of consumers would be more likely to visit a restaurant if it had been certified as being compliant with various COVID-19 safety standards. And furthermore, if you add the I agree with this and the completely agree with this statement, a full 3/4 of our panel indicated that this kind of public certification, this public documentation of passing some tests and being credentialed would be reassuring to them. And while we've heard that this is possibly only a true concern for older generations, we see that those folks ages 65 years and older, 66% of those people are likely to visit a location with the appropriate certification. However, at least 50% of every other age group that we studied felt similarly. So across the board, this is important. And so with this notion of restaurant certification as the backdrop to building trust and building confidence, I wanted to turn our session over to Jim and let him talk a little bit about something Bureau Veritas is doing to help restaurant organizations.
Thanks, Brad. Yeah, we have a Restart Your Business with BV program that has been rolled out globally, and it started in Europe and it's been moving into North America, and it's really in response to our clients' needs for some sort of visual sign that they're complying with best practice. We find that our clients are falling into 4 groups now, really. The first is that they want to return their employees back to safe working conditions, but they still need help with their policies, or they're interested in getting feedback from independent third-party professionals, basically an expert review with recommendations to help them do it the right way. Others are happy with their policies, but maybe are having difficulty communicating and training. They're concerned about a consistent implementation across their brand. So basically following the right policies over time and validating that. I think the third group are the risk management group. You're worried about ongoing compliance. Inevitably, if your policies are challenged or if you get sued, somebody on social media is posting failures on the part of your staff or your locations, you need to be able to demonstrate that you've made a good faith effort to have your policies reviewed, and that you've also tried to audit that those policies have been properly implemented. If you're able to do that, there's kind of that fourth group, the customer trust. Once you've established that customer trust, you want to know that you've received a return on investment for the huge investment that you're making, both in actual physical costs as well as training. And a labeling program can do that. If you get a label, a certificate, that the group that stands behind that is basically assuring the customers and your own staff that you have had an independently reviewed set of policies that have been successfully implemented. So here's how our policy works. The program that we've rolled out, I know there are a lot of certification programs that are out there now, and labeling programs are emerging. Here's the approach that we take. Again, we're one of the global leaders in inspection, testing, and certification. And through our partnership with the Cleveland Clinic here in North America, the way it works, we have a 2-stage review. So we look at your policies, your protocols, the way that you're communicating those to your staff, your training, your vendor agreements, the physical changes that you're making at the store. We take a look at all of those documents with our certified industrial hygienists, our health and safety regulatory experts, and we write up our opinions, our findings. Those are then independently peer reviewed by the Cleveland Clinic. And we come back to you with a consultation. So we'll make recommendations about how you can improve your programs. The next step is up to you. The communication and training phase is where you take those recommendations out to the field, you implement your policy, you train your staff, you make your changes, you put the right practices in place at your stores, and then you give us a call and we send out on-site auditors to validate. So basically they go out with, it's an announced audit with a checklist. We do field data collection, we go through the checklist, and then we will come back to you with the results for that. There's a web portal for reporting and key performance indicators. And you, at that point, if you're successful, you are awarded our safeguard label, which means you've successfully completed the process. If there are non-conformities, you're able to track those issues, things that you need to work on. You can also look at non-conformities over your entire portfolio to see where you may be having issues regionally or with certain types of measures that need to be implemented. And then you work through those to earn that safeguard label. That gets you into that kind of fourth group where you have a label. It shows people that there's something behind it. There's a QSR code on there that links back to a website, so you're able to achieve transparency. Our labels are good for 6 months. The advantage to that is that it lets the public know that they're current. So you're not going to get a faded sticker from a couple of years ago, meaning that you met the standard way back when. Ours are renewed every 6 months so that you're keeping up with the changes that are taking place. Beyond that, we recommend ongoing validation. The customer experience types of services that Market Force offers are very good. You can do secret shopper inspections during the labeling period for additional validation, or you can do other types of services that Brad could describe.
Jim, thanks so much. The combination of a global business like Bureau Veritas and Cleveland Clinic is a really powerful combination. And to your point, the ongoing recurring opportunity occurs after the earning of a safeguard label, which is great. A sticker on the window will absolutely put the confidence back into the equation. But scheduling recurring visits to quote unquote inspect what you expect will help measure compliance with safety standards. This can be done weekly, every other week, monthly for the balance of the year. Similarly, getting feedback from your guests on how they feel about your standards and the adherence to those standards will be important. Letting them tell you how they feel about your brand will give you the confidence that you are in fact executing on your plan. In addition, and I think we're all feeling this as employees somewhere, team members are likely working in new and unusual strains. And so getting insight into their mental health and their well-being will be an important consideration that leading brands have to take into account. And so an employee wellness study will be critically important to making sure that you keep your finger on the pulse on how folks are feeling. So we talked earlier about the notion of switching. We mentioned that 20% of customers during the pandemic were actively trying a new restaurant. We also learned that 21% were very likely to switch to that new restaurant that they were trying. So for those of you that know Market Force, you know that we've got a really fantastic team of PhD statisticians and data scientists who do tremendous work in predictive analytics, but we had them evaluate and model this panel data, and obviously they had the input of the 20% trying a new restaurant, the input of 21% likely to switch, and they were actually able to quantify that this is going to likely represent a 4.2% decrease in transaction counts for those restaurants that don't execute well on some of the things that we've been talking about here. So getting this right is both a defensive move to save share, as well as an offensive play to steal share from other, maybe less consistent brands. And in such a hyper-competitive market, every single option should be considered to stabilize and grow coming out of this pandemic. So if you have questions on either the consumer sentiment measure study work that Market Force Information conducts, or you'd like to know more about the Restarting Your Business initiative, please get in touch. Jim, thank you so much for joining us today. It was really great to have your expertise with us. And Gina, with that said, maybe if you could open up the forum for any questions that we might have from the audience.
Sure. We do have a couple that just came in. This one is for Brad. You've conducted several sentiment measures. Do your results suggest that what's really going on in customers' minds has to do with trust?
Yeah, so it's really interesting, right? So Bureau Veritas, their very name is truth. And so it's an interesting point for them to be a part of this conversation. But the three ways we've conducted, there's a recurring theme, and I think it popped up early in the first study where 80% of the consumers we studied suggested that they want to continue doing business with brands that they trust. And they intimated that they lost trust with brands who didn't manage social distancing properly, who didn't demonstrate the appropriate use of PPE. And in fact, what we're seeing now, kind of as a sidebar here, tons of viral insight from just everybody out in the public taking pictures of restaurateurs without their face masks on or the face mask around their throat, social distancing being not followed very well. And obviously with these enhanced case counts that we're seeing over the last 4 or 5 days, it's just increasing the businesses that can instill confidence with their people and their guests are going to win in this new kind of post-pandemic environment.
Yeah, to concur with that, Brad, I think that the converse is true. If you do go into one of your favorite restaurants and you're not impressed with how they're handling all of this and you decide to switch out to someplace else and you are really impressed, you may become newly loyal to that brand, and they have an opportunity to take that market share.
Great.
Anything else?
Yes, we have one more question. This one looks like it's for Jim. How long does a typical implementation take?
Well, there are really two stages, as you recall in the timeline. The actual policy review. Most of you, if you're running a QSR, if you have a restaurant, it's not like you are not open at all right now. You are probably open, whether it's carry out or delivery. So you already have policies and procedures in place. And we assume that there's a spectrum. There are people who have minimal policies and they're just trying to get back up and running with kind of CDC guidelines, or you may have really comprehensive programs. Wherever you fall on that spectrum, it takes us under 2 weeks. Usually it's 6 to 10 business days to conduct a complete review. We complete our review in, say, 6 to 8 days, and then the Cleveland Clinic will typically turn around their peer review in 2 business days. So it's pretty fast. I mean, really, there's a sense of urgency right now. People are opening, and then they're closing, and then they're opening again. So it's going to be very fluid, but really the time is now. You can go ahead and get those policies reviewed, and then it's up to you. You have to decide when you're ready to have your stores audited. If you have us come out and not ready and there are a lot of nonconformities that you have to work through, we typically allow about a week to 2 weeks for nonconformities to be resolved. And if they're not, then we would require a re-audit of that site in order to achieve the certification. So for a typical portfolio, let's say you have a couple of hundred stores, we could usually get those done in less than 30 days. And we have a tremendous amount of bandwidth, but we deliver those on a rolling basis. So they post to a public web portal that you have access to, where you can look at your results as they roll in, and also track nonconformities. So, and then of course the label is good for 6 months. So the whole process, you figure a month and a half on the front end, and then 6 months of certification.
Fantastic. Thank you, Jim.
Anything else from our audience?
No other questions that came through.
Great. With that, for everybody who's dialed in to join us and those of you who are listening to us after the fact on Market Force's website or our YouTube channel, thank you so much for hearing out our point of view here. We are excited at the notion of being able to learn what's going on with consumers and bringing interesting consumer confidence capabilities like what Bureau Veritas brings to the table. So thanks for joining us. Take care.
Thanks all.